Right then, so as Marilyn said, this all came from her in terms of her experience with patients and with families. And so what we tried to do in public health was to come up with the rationale as to why it was so important in terms of the sort of wider public health population level evidence. This is just a graph showing the infant mortality rates in Kirklees. Each of them, on the very far right-hand side is the England and Wales rates, and the one in is the Kirklees overall rate. I mean, the most obvious thing to see in that graph is the discrepancy between the various localities. And we do know that as a result of the audit that we did on infant deaths within Kirklees, that predominantly the infant deaths to the white population were to do with the mother's health behaviour. So smoking particularly during pregnancy in Dewsbury, in those women that actually suffered an infant death, was probably over 55%. Generally in Dewsbury, women smoking at delivery, irrelevant of whether they had suffered an infant death, is over 34%. So that's significantly higher than actually the Kirklees average, which is 11%. So clearly Dewsbury, particularly in terms of its high infant mortality rate, but equally its high rates of poor maternal behaviours. So what we did was we focused the project to North Kirklees, which is Dewsbury, Batley, Burslem, Berkshire and Spen, as opposed to some of the more affluent areas that surround Huddersfield, like the Home Valley, the Combe Valley. So we had to tailor the project into a specific area because we knew that was where the majority of the issues were. In terms of, obviously, what Marilyn's touched on is the increased problems around respiratory, but we did do some research and looked at the evidence in terms of how many children are admitted to hospital under 5 as a result of exposure to second-hand smoke. And, the estimates are it's about 17,000, which is a huge amount of money in terms of 40 million. But irrelevant of the money, that's a huge amount of people. And actually, if we could do something that might be able to have an impact on that, for even one child, that's obviously something really positive. As Marilyn mentioned earlier about Every Child Matters in education, there is also that link between having problems, respiratory problems, difficulty breathing. Children are more likely to be absent from school, which again will impact on their outcomes in terms of academic achievement, etc.